My name is Noelle. I'm an educator with American Ambulance. We're here to discuss the overview of a call. As you're arriving on a call, you want to determine your SNAC, which stands for S, scene safety. Are there any hazards you need to deal with before you arrive on scene? N, number of patients. Second N, nature of illness or mechanism of injury. Know what you're dealing with. A, do you need any additional units, such as law enforcement, fire department, PG&E, etc.? And C, is there a need for spinal immobilization or C-spine attendance? The next phase of the call is when you're making patient contact or approaching the patient is your primary survey. You want to make sure that you are checking the patient's airway, breathing, and circulation. You can start that as you're approaching the patient. Do you recognize that the patient is awake and alert? Are they breathing? Are they breathing effectively? And how does their color appear? As you're making contact with the patient, you're going to be checking a pulse to make sure they do have a pulse, and is it an adequate pulse? Do you see any heavy bleeding that you need to control now? After you've completed your primary survey and determined your transport decision, you need to move on to your secondary survey, which includes history taking. That will start with your sample survey. That includes signs and symptoms, allergies, medications, past medical history, last oral intake, and event leading up to the incident. When you continue on with your assessment, you're going to be doing your OPQRST. That includes onset, provocation or palliation, quality of the pain, region or radiation of the pain, and severity, also time of onset. Also included in that for respiratory problems would be PACE, which is provocation or progression, associated chest pain, sputum, time of onset, and exertion.